Imagine you're lying in a hospital bed. It's an emergency. There's beeping and rushing all around you, and you feel fear and uncertainty about what might happen next. Then you hear the words, "Damn, I forgot my password." Hi, this is Matt Strahan from Volkis, and I'd like to talk a bit about cybersecurity in healthcare, and why we have to take a different approach for healthcare organisations. When you ask the average person about the biggest risks in cybersecurity for healthcare, their first thoughts usually go to patient records. They think of the embarrassment and uncertainty if their medical records are released. They might think of examples like when the Duchess of Cambridge's health status was released. Or perhaps the fears around how the COVID apps handle user data. I'm not going to say that the confidentiality of medical records isn't important. It is. The release of those medical records could be a huge privacy violation. It could affect the personal lives and careers of everyday people. But there is one thing that will keep hospital staff up at night even more than the potential release of medical records. Unlike most other industries, it's not the confidentiality that's most important. Unlike most industries, it's actually the availability of medical services and medical records that's most critical. Making sure that medical devices can be used when they're needed. Making sure that medical records can be accessed when it's critical. With modern interconnected hospital systems and digitally run medical devices, when hospital systems are down, they might not be able to provide healthcare anymore. Confidentiality could cause a huge privacy violation, yeah, but a loss of availability could lead to a loss of life. This topic has been put center stage with the ransomware attacks on hospitals around the world. The first main outage caused by a ransomware attack was back in 2017 with WannaCry. It brought down systems in the NHS. Since then, unfortunately, ransomware attacks on hospitals have become a regular occurrence. Just last week, several hospitals in France weren't able to provide surgery or accept emergency patients because their systems were down. In Germany, the first murder case was raised against ransomware gangs recently, when a woman died while hospital systems were down. Now, they ended up ruling that ransomware wasn't responsible, but prosecutors there said it was only a matter of time before an attack against hospitals becomes a murder case. This leads to heavy protections being put into place, but those protections can themselves be an issue. In 2019, there was a study that was released that showed that 3 years after a cybersecurity breach, the mortality rates went up. Now, this effect was small, but it was significant. And it wasn't actually the breaches themselves that were the issue. Instead, it was the remediations and security controls that were put in place after breaches. It found that overzealous security controls could affect the quality of care. In healthcare, the availability of medical services has to be paramount above all things. And this has to be incorporated into cybersecurity in all levels of healthcare organization. It has to be incorporated into the cybersecurity strategy of the organization, and it has to be incorporated into any decisions around IT or cybersecurity that the organization makes. Let's take authentication as an example. When we think of authentication, we often think of account lockouts or screen lockouts. We might think of phone-based multi-factor authentication systems. But do you really want a doctor to be locked out for 15 minutes because they happen to forget their password 3 times in a high-pressure situation? Do you want a doctor to be constantly unlocking their screen? Can they even do that while wearing gloves? Meanwhile, can they take a phone to all the places that they might need digital information, let alone use that phone while wearing gloves? Meanwhile, business continuity and redundancy take on new meanings when it comes to cybersecurity in healthcare. We might joke that backups save lives, but in healthcare, business continuity can literally save lives. Cybersecurity in healthcare is even more curious and unique than the availability issues that I've talked about here. Make sure you subscribe because we'll be doing more videos about cybersecurity in healthcare and other unique issues that they face. If you have any stories or insight around healthcare cybersecurity, then comment below or email us and we'll get back to you. If you need help with security in your healthcare organization, then let us know. Use the Contact Us link below or email us at info@volkis.com.au. Otherwise, this was Matt Strahan from Volkis, and good luck building resilience and business continuity into your healthcare organisation.